Good evening, everyone. Thank you, everyone, for joining us in today's live session. We're excited to invite you all to a transformative live event hosted by Indian Spinal Injury Center, aimed at shedding light on spinal cord injuries and providing a platform for understanding, learning, engaging to an absolute enriching experience. Um, Thank you, everybody, for joining us. Let me introduce you to our panelists. Um, Dr. Shalini Bhalla, Medical Director, Spinal Cord Injury Experts, Dr. Vikas Tandon, Chief of Spine Services, Dr. K. Das, Director Spine Services, our expert, our expert, neurourologist, Dr. Dinesh Suman, Director Neurology, Urology, and SCI Andrology, reputed plastic surgeon, Dr. Sobti, Chief Nursing Superintendent, Ms. Neetu Maitra, Chief of Rehabilitation Department, Dr. Chitra Kataria, and Mr. Nekram Upadyay from Department of Assistive Technology. The highlights of today's live session are comprehensive insights into SCI causes, treatments, and rehabilitation, engaging discussion on advancements in medical technology and therapies, personalized stories of those who have navigated their SCI journeys. I'd request everybody to also share their questions in the chat box so that during the session, our panelists and doctors would be answering those. We are here today in promoting awareness and understanding about spinal cord injuries. Let's come together to empower ourselves with knowledge and compassion. To start with, I'd like Dr. Vikas Tandon to throw some highlights on what SCI is and what are the awareness plans that we have and the importance of 5th September.
Thank you, Karishma, for this question. So, spinal cord injury is actually a very devastating injury, and we at ISIC deal with all these kinds of patients who have these injuries. Usually, these kind of injuries are there because of multiple modes, but the most common mode of injury usually is the road traffic accidents, followed by fall from heights. So if you talk about the data, Rishma, I would say that recently I looked at the data in our institute actually, and I looked at from 2012 to 2022. And if I looked at the spinal cord injury patients, there were about 1,600 patients that we had in-house in the hospital. And again, out of these, about 650 or 660 were all because of road traffic accidents. Looking at the percentage-wise, road traffic accident is the most common mode of injury causing spinal cord injury. Now, why do I say spinal cord injury to be devastating? Because it all depends upon the level where you are hit. So if you are hit in the neck, you can actually land up with a problem called quadriplegia, wherein both your upper limbs and both your lower limbs, they don't work, they don't move. You lose your sensations below that, and you lose your control of urine and stools. If you are hit in the thoracic region or in the lumbar region, you may lose both your control of both your legs and your bowel and bladder and sensations. So this is what we do. We actually manage these patients. We have a holistic approach to these patients, especially at our institute, that is Indian Spinal Injury Center. We have a team wherein, because of this holistic approach, we are able to take care or do an end-to-end solution to the patient. We surgeons operate these patients if required to stabilize the spinal column and decompress. Then we have our rehabilitation team taking over, consisting of physiotherapists, occupational therapists. Multiple times we need these patients develop bed sores because they don't sense anything below the level of injury. Therein, we have our people, we have our specialists like Dr. Sobti, plastic surgeons who would take over. Then, most of the patients, they don't have control of their urine and stool. Therein, we have our urology, Dr. Dinesh Suman coming in. And this is how, with this holistic approach, wherein we have people from assistive technology to teach wheelchair skills, to make wheelchair, to make assistive devices. So basically, a holistic approach, giving an end-to-end solution. This is what SCI treatment is all about, and this is what at ISIC we do. Can we go ahead with the questions now?
Thank you so much,
Thank you so
Dr.
much.
Vikas, for enlightening us, all of us, of what a spinal cord injury is all about. Dr. Das, we'd like to ask you a question. Do all spine injuries confine a patient to a wheelchair?
Thank you for the question, Karishma. It's a very intriguing question. All spinal cord injuries may not enable you to be or entitle you to be leading a life from a wheelchair. Going back to what my fellow colleagues said, the chief, that depending upon the level of the injury. So if you are a quadriplegic, which means if you have an injury at your neck, you may need a person's assistance to balance yourself or to be aided while you are in the wheelchair, but not necessarily that everyone should be in a wheelchair.
Okay, okay. And Dr. Das, all spine surgeries are safe, considering that a lot of people are very fearful when we talk about having a spine surgery. So, what would you advise us on that?
In today's world, we weigh the risk and the benefits of the surgery. But if you want me to answer this question in one line, yes, spine surgery is safe when it is done by experts who have been trained and have the experience to back them. In our center, Indian Spinal Injury Center, if you take the common age of surgical experience among us is 30 years plus. And most of us have been trained abroad by the best of the surgeons in the field of spine surgery. To add to our expertise and experience, we have the backing of the best technologies that is available in today's scientific field, whether it is monitoring, imaging, or robotics. So when there is an amalgamation of experience with technology, the outcomes or the weighed outcomes and the prognosis is very predictable, and it is a safe surgery that takes place.
Thank you so much, Dr. Das. Taking the same discussion forward, Dr. Vikas, we'd like to know from you what are the recent improvements in technology in the field of spine surgeries.
If we talk about the technology, I think Dr. Das already mentioned. When it comes to surgical aspect of it, I will only talk about the surgical aspect of it. We have newer technologies wherein we have navigation systems, we have robotic systems to make our surgery more precise, to make our surgery more accurate, right? So the surgeries have definitely become very, very safe over a time period. And as Dr. Das also mentioned, the expertise that we are a team of 10 spine consultants who have been trained intensively nationally and internationally. And we have all the latest technology that is available in the world at ISIC at our disposal for use on such patients, on these patients, where we can make their surgeries much safer. That's one. Second, other than this, there is a lot of work going on, like stem cell therapy, like into drugs, as to what drugs can help regeneration of spinal cord. But unfortunately, we have not had a breakthrough as of now. Right? It's still on the experimental basis. There are few reports now and then, but we cannot take them as we cannot advocate as that they are the mode of treatment right now, because they are still into the experimental stage. So yeah, that's it. So we're still there and waiting for a breakthrough.
Yes,
Thank
I
you.
believe globally everybody is actually working on spinal cord
Absolutely,
injury treatment
absolutely.
for a breakthrough.
Absolutely.
Thank you so much, Dr. Vikas. Moving forward, Dr. Chitra, you being the expert at the rehabilitation department, we'd like to know from you what kind of rehabilitation programs do we offer to the patient just after injury, and how does it help the patients?
Thank you, Karishma. It's a very good question. So, as we have discussed, that spinal cord injury follows the concept of total care starting from the time of injury. So, it requires rehabilitation start as soon as possible in order to ensure the best result, and multidisciplinary team involvement should be there. So, we do the interdisciplinary team assessment first as soon as we receive the patient. And broadly, the rehabilitation divided into three main phase: acute, subacute, and chronic phase. So in acute phase, our main emphasis is on prevention and management of complications. So we do focus lots of our focus on respiratory and care, chest physiotherapy, and different kind of exercises depending on the functional expectations and patient outcome, passive movements, active assisted exercises, and positioning. And then as soon as we mobilize the patient on a wheelchair, we immediately start with the tiltable activities, mat exercises, and we teach the patient how to turn in the bed, because initially the balance and push-ups are very, very poor, and that requires the activity of daily living. So we teach activity of daily. If cervical spine injury, then hand functions are also compromised. So with or without adaptive devices, we also teach how to eat, how to write, how to operate the computer, these small things. And we focus on active rehabilitation. That means we actively involve the patient in our rehabilitation program. So we teach him or her how to propel the wheelchair and how to transfer from bed to wheelchair. And later stages in chronic phase, the community reintegration is very, very important aspect, without which the whole meaning of rehabilitation has been lost. And whatever we teach in the hospital setup is beneficial only if this aspect is successful. So all type these type, then we have many innovative rehabilitation approaches like sports therapy, wheelchair dance therapy, and wheelchair yoga, all these, and advanced treatment rehabilitation approaches also we have, like aquatic therapy. Then we have the locomotor training for gait and balance, virtual rehabilitation technique, functional electrical stimulation, task specific training. We focus more on that, enhance the neuroplasticity and with the quick recovery.
Okay, thank you so much, Dr. Chitra. Talking about bed sores, a very sensitive topic, especially when it comes to people who've been on the wheelchair and who are wheelchair users. If not treated well, they can be really, really devastating. Dr. Sobti, we'd like you to please highlight few pointers when we talk about pressure sores. Why do pressure sores happen? And what other treatments would you will suggest to all our SCI patients?
Okay. So pressure source, as the name indicates by itself, occur because of unrelieved pressure. And why is the pressure unrelieved is because that feedback sensation, like when you are standing all the time, your feet tells you to move a bit so that the pressure gets shuffled. But this feedback goes away because of the spinal injury, and you stay on in that same position. So unrelieved pressure is the most common cause. Also added on and contributed by friction, when you get pulled on the bed because you can't pull yourself, and shearing your own body, shifting up and down with a static bone, and because you've become incontinent for urine and stools, so moisture lesions, weakening the skin. So all these factors contribute to our pressure sores. And obviously, once you're in a tertiary care center like us, we start at the word go by putting you on some kind of air mattresses, which are alternating air pressure systems, so that the pressure doesn't stay there all the time. We put you on skin guard creams so that moisture doesn't damage your skin. We have more trained personnel, and like just ma'am just mentioned, your rehab, you're trained how to shift, how to get out of the bed so that you do not need surgery.
Okay, thank you. Thank you so much. Dr. Sobti, one thing I'd like to ask you. We've had a lot of patients in ISIC who've been treated well and who know the knowledge of pressure sores. But we've had a lot of patients who've been spinal cord injury survivors, but not been patients of ISIC. Later, they've come to ISIC and they've been in really bad situations with pressure sores. So how have we dealt with that, and how do we stand different when we talk about pressure sores, especially for SCI patients?
What we do differently, probably what is also the reason why we achieve more success with treating these patients, is the same, the holistic approach. So we are all, the whole, our staff is attuned to frequent change of posture. They are attuned to the fact that they have to be nursed on air mattresses. They are attuned to the fact that moisture lesion shouldn't occur. They have to keep the skin dry. That thing is inculcated into them. That's why our own patients, we have very few who develop these injuries. And the ones who come back to us from other centers or who already have bed sores, whom we offer surgical treatment, who have successful surgical treatment, that holistic care is the backbone. The healing phase, we know what to do during the healing phase. The whole staff is attuned to that, because surgery is just one point in time.
Right.
And
Right.
the remaining supportive care being so important
Absolutely.
results
Absolutely.
in success of the treatment.
Absolutely. Dr. Vikas,
Yeah, can I just
please
add on to what Dr. Sobti said? I mean, definitely his word are more important because he's the one who deals with them. But rightly said by Dr. Sobti, it's a holistic approach. So sheer forces put a man or a woman at risk to develop a SCI or to develop a bed sore. But actually, what we teach over here is, let's say start from that side, maybe Nekram. He teaches the wheelchair skills, right? So he develops those memory foams, those specialized seats where a person can sit for a longer time and not develop a bed sore. He teaches them that people have to take away the pressure after every 20 minutes, 15, 20 minutes, so that patients do not develop a bed sore. Dr. Sopti is definitely a so we have rehab team. Dr. Dinesh Suman teaches them right time CIC, so they do not wet their beds. So this is what. So basically, a holistic approach.
Yeah.
Yeah. So
We have tissue viability nurse here in SCI. So the thing is, tissue viability nurse, what she does is we do assessment, complete assessment of the patient at the time of admission. So the complete skin assessment has been done by the specialized tissue viability nurse. She is trained under Dr. Sobti. So she knows how to do it, and we are assessing our patients in every shift, the standardized international scale according to the Braden scale. And our nurses are well trained to take care of pressure sores, and that's how we are preventing as well the pressure sores.
So
Thank you.
again,
Yes.
the same concept, a holistic approach to dealing with a patient with spinal cord injury. Back to you.
Yes. Okay, thank you so much, Dr. Neetu and Dr. Vikas, for adding points on this. After pressure sores, there's one very important topic when we talk about, rather a neglected topic, which we talk about, and only ISIC, if I can say so, really talks about in detail when we talk about bladder issues and bowel-related issues. Going to Dr. Dinesh, so I'd like to know from you, what is neurogenic bladder and why is it considered a neglected health issue in SCI patients in India?
Thanks, Karishma. After spinal cord injury, there is damage to the nerves traveling in the spinal cord from the brain down to the end organs. As a result of that, the communication between the bowel, the bladder, and the brain is lost. So most of the spinal cord injured patients would have some or the other form of urinary, bowel, and sexual dysfunction, and that's something which remains neglected in most of the cases. It is a matter of surprise, rather a shock, to know that over 90% of spinal cord injured patients treated with the state of the art surgeries and world class surgeons remain neglected with their neurogenic bladder, neurogenic bowel, and sexual dysfunctions. We carried out a survey at the Indian Spinal Injury Center. All the patients who've been treated